The Eastern Cape has entered a second wave of COVID-19. This as infections continue to rise. Authorities in the province have been proposing a tightening of restrictions, which will take the province back to level 3. For more on this, I'm joined by the Eastern Cape Premier spokesperson, Mvusiwekhaya Sicwetscha. Thank you very much, sir, for speaking to us this afternoon. What measures are being undertaken to control the spread of COVID-19 in the Eastern Cape at the moment?
Thank you very much. Good afternoon to you and your viewers. Look, there are quite a number of measures that we are putting in place. One is the mass screening and testing, where we're going to community centers like shopping malls to test people and track and trace those that have tested for COVID, that have tested positive. If I can give you some data, for instance, some raw data from the weekend, we had conducted in the malls in the Nelson Mandela, in the hotspot areas like the Newton Park, the Motherwell, Inago Mall, Clary Park. We've conducted a total number of 1,639 COVID tests. In that number, 207 came back positive. Now you can look at that epidemiologically. We are tracing those people. The numbers for the province are increasing. Remember, we for a long time, we had numbers that were below 100,000. And once we hit the 100,000 mark, the numbers started borrowing eagle wings. We are now looking at numbers at 125,000, while we're seeing recoveries at around 109,000. We are worried by the numbers of infections that we are seeing in the Nelson Mandela Bay Metro. So what we've done is we've looked at the data, and data shows that some of the infections are coming from social gatherings like churches, funerals, parties, taverns, and shebeens. So we are going to all these places, taverns, bars, and all that, to enforce compliance. We have issued 2 compliance notices to 2 facilities, and we want them to comply with the law. The other thing that was picked up in the Nelson Mandela Bay Metro, and it's happening in Bisho also, and in other parts of the province, where people buy alcohol, and after the closing time of these watering holes, they sit outside and consume alcohol. They do that without wearing masks. So in PE, we disperse those people. We are working with the alcohol industry to enforce these regulations. About 80 patrollers will be working with the 8 police stations in Nelson Mandela to work with communities and police to monitor compliance by all these taverns, all these liquor trading facilities. So we are doing this to make sure that people who go there, they are limited to the number, which is 50% capacity, and they wear masks, they all sanitize.
Mr. Sicwetscha, very proactive action on the part of the alcohol industry there in partnership with the province. But talk to us about a return to level 3 lockdown restrictions.
Look, at the moment, we're talking to the national government and municipalities. We are focusing our intervention on clinical response, making sure that at the hospitals we beef up capacity. Doctors from Cuba are coming in to beef up the teams that we have. We are attending to challenges that we have seen in some of the hospitals. We are finishing up a number of wards. We are making sure that we educate the people of our province. The epidemiological report now is being released on a daily basis so that we all understand what is going on. We are enforcing the regulations also. And we can say now, while we don't have a decision on moving up or down of the alert level, there is nothing that is off the table. We are focusing on saving lives, but we can put all these measures. If the people of our province are not playing their part, if they're not wearing their masks, if they're not sanitizing, if they're not keeping physical distance, all these things are not going to be effective. They can be effective only if our people stand up and play their part, wear the mask as their shield to protect themselves, to protect their families, their loved ones, and to protect their communities. We need to do this, and we need to report those that are not complying with these regulations. We, as a last point, we appreciate the decision that was taken by the liquor industry to say establishments that are not complying with COVID-19 regulations and the conditions of their licenses are not going to be supplied stock by the alcohol industry. We are talking about big manufacturers here of alcohol beverages. So we're saying to these guys, we've given you licenses to trade for your own livelihood. So don't take that away. Don't put your life and the lives of your customers and of your community at risk by not enforcing regulations.
Mr. Sicwetsha, very quickly before I let you go, can you talk to us very briefly about capacity in hospitals and ICU units specifically?
The hospitals in the Eastern Cape province are not full, they are not overflowing. What we have done during the earlier stages of lockdown was to build more capacity. The field hospital in Nelson Mandela, the Dr. Chabula Mamisa hospital is not full. It still has got space. I think we have just above 1,400 available beds. Some of those beds are ICU, some are high care, some are oxygenated, some are isolation points. That hospital has got 300 or close to 300 people. Livingston at Dorangiza, with increased wards, they're working with the private sector and also government putting in more wards. They've converted space to put in medical resources so that our people are taken care of. What the Executive Council of the province has pronounced was that the Department of Health must improve management of patients when they get to triage, so that you don't have people infected or people suspected of having contracted the virus sitting in the casualty. People that need emergency medical care need to be admitted to wards so that they get that health care. There's oxygen in our hospitals. So EXCO said health must stop these problems that cause a high number of people to be in the casualty, some even demising while waiting for health care. So we are doing this to improve our health capacity.
Well, thank you very much. Apologies there. We have to cut that short. Thank you very much for taking the time to speak to us. That was Eastern Cape Premier spokesperson Mvusiwekhaya Sicwetsha.